Today it's 3rd of September 2023, and today it was this pre-university exam of anatomy at Naraina Medical College and Research Center, Kanpur of MBBS 2022 batch, and this question paper is of anatomy paper-1 part-2 of maximum 3-hour duration and maximum of 50 marks can be achieved. This question paper pattern is according to the Atal Bihari Vajpayee Medical University of Lucknow, to which this medical college is affiliated. So as you can see here, the first question is a clinical question of 15 marks of 3 subparts, 5 marks each. And the question is, a 7-year-old boy has been having high-grade fever for 5 days. On evening, he complained of weakness in his right lower limb. Soon he could not support the weight. What is the probable diagnosis? Which part of the nervous system is affected? What type of paralysis is it, and what are its features? So because here they have mentioned is that the subject is a child. One thing you can appreciate is that is a child of 7 years and is having a high grade fever. That means there is infection, and that infection has been lasting for 5 days, and because of that he started developing weakness in his lower limb, and that is of the right side. So it probably is they're directing it towards poliomyelitis, because there is an acute rise in fever, and suddenly after that you find that he starts developing weakness, and later on that weakness is such that he is not able to support his body weight. So that means the diagnosis you can write is of poliomyelitis, which is a viral infection, and this viral from the GIT via the axonal pathway, it reaches to the spinal cord and gets settled into the anterior horn of the spinal cord. And you know, from the anterior horn of the spinal cord, it's the lower motor neurons that emerge out via the ventral root. So if this virus attacks the anterior horn cells of the spinal cord, there is going to be a lower motor neuron type of paralysis. And remember, the more common site of infection due to poliomyelitis is the lumbar segments L2 to S5. But if this reaches higher up to the cervical segments, let's say C4, then it can be fatal as well, because there it's the phrenic nerve that arises from the anterior horn, and phrenic nerve, you know, it controls the movements of the diaphragm, so that can be fatal. Next question here is, which part of the nervous system is affected? Already told you that it's the anterior horn of the spinal cord which gets affected, and what type of paralysis it is, and its features that I told you is lower motor neuron type of paralysis. And in this condition it is a flaccid type of paralysis where the muscles feel flaccid, right, and the loss of tonicity, and the tendon reflexes get abolished, and that's why Babinski will be negative, and gradually there will be reaction of degenerations will be seen. That means if you're not using the organs, he is not able to support his body weight on this right lower limb. His muscles will also undergo atrophy. So the changes of muscular atrophy will lead to shrunken lower limbs, thinned out lower limbs, and it will be visible. You can compare both his right and left limb. You will find that his right limb is thinner, contracted, and much weaker, right? So these will be the features which you can appreciate in this lower motor neuron type of paralysis. So it's a precise question. You just have to write according to whatever has been asked. You don't have to write much in this question. So that's why I keep saying that in clinical questions you can score good marks. Next question number 2 is 3 questions of 5 marks each, that makes 15 marks. First one here is accommodation reflex. Accommodation reflex is when you converge the eyes towards a point of focus closer to your face, nearer to your eyes, means you will have to contract both the medial rectus at the same time as well as the eye lens will increase in curvatures so as to focus the divergent beam of light onto the center of the retina, that's fovea centralis. For that, the curvatures of the lens should be increased. The power of eye lens should increase, and also the pupils should constrict so as to allow more amount of light to reach through a smaller opening so that you can get a brighter image. So all these 3 points needs to be discussed here in accommodation reflex, and I have uploaded a video on this accommodation reflex. I am attaching the link in the description of this video. You can watch it from there. Then next one is lacrimal pathway. This lacrimal pathway is actually the pathway which passes through the pterygopalatine ganglion, right from the lacrimatory nucleus through the greater petrosal nerve via the facial nerve. This branch, greater petrosal nerve, which is actually the first branch of facial nerve arising from the geniculate ganglion within the wall of the middle ear, and it emerges out through the roof of the middle ear through an opening that's called the hiatus for the greater petrosal nerve, through which these fibers emerge out into the middle cranial fossa and descend downward and medially to pass out through the foramen lacerum. When it reaches the foramen lacerum, anteriorly there is a canal, and that's called pterygoid canal, where this nerve joins the deep petrosal nerve to form the Vedian nerve, or the nerve of pterygoid canal, which opens into the pterygopalatine fossa, where you find a ganglion suspended by its two rootlets from the maxillary nerve, and that is called pterygopalatine ganglion, where this greater superficial petrosal nerve carrying the preganglionic parasympathetic fibers from the lacrimatory nucleus will relay here the postganglionic parasympathetic fibers via the maxillary nerve, will emerge to the zygomatic nerve. Then through the zygomatico-temporal nerve, it will cross the lateral wall of the orbit and will now communicate with the lacrimal nerve to supply the lacrimal gland and cause for the secretions, that's called tearings. Then ulnar nerve injuries. Ulnar nerve injuries are common at two sites where it is prone for entrapment neuropathy. One is in the Gwen's canal at the wrist, and one is cubital tunnel syndrome behind the medial epicondyle of the humerus. Both these injuries I have described in detail in a video, and I have attached the link in the description box. You can watch it from there. Next question is write short answers on. These are 5 questions of 2 marks each, that makes 10 marks. So you have to describe in less than 100 words. So you have to be very brief while describing. Floor of the fourth ventricle, you can simply draw a diagram to explain this. I have a video for this and I've attached the link. You can watch it. Blood supply of internal capsule is a super important question. You should be prepared with this. Internal capsule, corpus callosum, the white fibers in detail before going for your university exam. And especially the blood supply of internal capsule is very important. Then circulation of CSF is also important. Its formation, circulation and drainage, everything. The choroid plexus, stela choroidea, the communications of the ventricular chambers, then how it comes out into the subarachnoid space and how it is being drained from this arachnoid villi and granulations into the superior sagittal sinus. Everything you have to write here. And even how it communicates to the perineural lymphatics. I have made a video on this. I have attached the link on this circulation of CSF also. You can watch it from there. Colles fracture and dislocation is a fracture of the lower end of the radius at the corticocancellous junction, such that the distal fragment is displaced dorsally and upwards, leading to a deformity called Dinner-Fock deformity. You can read the books for details. Next question here is on X and Y chromosome. This is a small question from the genetic portion. So here you have to describe about X and Y chromosome. Means you have to describe the structure, the group in which they are placed in a karyogram, and other important features. So let me tell you that there are 22 pairs of chromosome apart from this X and Y. So on a karyogram, these chromosomes are divided into 7 groups A, B, C, D, E, F, G on the basis of the size of the chromosome, the coiling of the chromosomes, and especially the position of the centromere, like metacentric, submetacentric, telocentric, acrocentric, likewise. So you have to mention that where actually X chromosomes, remember that X chromosome actually belongs to the C group of the karyotype, which is medium size submetacentric, while this Y chromosome is grouped in the G group, which includes the acrocentric type of chromosomes. You can read it from the book and you can write more of details for these two X and Y chromosomes. You can also mention about the hereditary characters related to these chromosomes, like hypertrichosis is related to Y chromosome. Presence and absence like monosomy of X leads to Turner syndrome. Likewise, you can mention all whatever information you can gather. So keep reading a little bit about these important facts of chromosomal anomalies. Now question number 4, that is multiple choice questions. You have 10 MCQs. The first one here is, which of the following lemniscus is not seen in the midbrain at the level of superior colliculus? Medial lemniscus, lateral lemniscus, spinal lemniscus, trigeminal lemniscus, MTSL. That's a formula, right? So remember that in case of superior colliculus, you're not going to see this lateral lemniscus. Answer is B, because this lateral lemniscus is in the auditory pathway made up of the third order neurons which communicate from the superior olivary nucleus to the inferior colliculus. So at the level of inferior colliculus in the midbrain, these fourth order neurons from the inferior colliculus emerge out through the inferior brachium to the medial geniculate bodies. So that's why you will not see this lateral lemniscus at the level of superior colliculus. It's only present up till the level of inferior colliculus. MCQ number 2, which is the dominant blood supply of cerebellum? Superior cerebellar artery, anterior inferior cerebellar artery, posterior inferior cerebellar artery, posterior cerebral artery. So remember that major portion of the cerebellum is being perfused by this artery, superior cerebellar artery. In case if they ask like the minimal blood supply to the cerebellum is by which artery, then your answer will be anterior inferior cerebellar artery provides the minimal blood to the cerebellum out of the 3 arteries. Remember, the blood supply to cerebellum is by A, B and C, superior cerebellar artery, anterior inferior and posterior inferior cerebellar arteries. Out of that, the maximum blood reaches to cerebellum is by superior cerebellar artery, and the minimal amount of blood reaches through the anterior inferior cerebellar artery. Answer here is A. MCQ number 3, which of the following cutaneous nerves has the largest area of sensory innervation? Saphenous nerve, sciatic nerve, sural nerve, posterior cutaneous nerve of thigh. Answer here is posterior cutaneous nerve of thigh. Remember, this nerve emerges from S1, S2 dorsal division, S2, S3 ventral division from the sacral plexus, means it has fibers from both anterior and posterior divisions of the ventral primary rami, and this nerve emerges out of the greater sciatic foramen below to the piriformis, and it supplies the skin of the back of thigh, the roof of popliteal fossa, and the upper portion, that is upper 1/3 of the back of leg. It also innervates the skin on the inner lower quadrant of the gluteal region, that is called natis, and it also innervates the posterior 2/3 of the perineum in the lateral aspect. So it has the widest area of cutaneous innervation. Posterior cutaneous nerve of thigh. Answer is D. Question number 4. Lining epithelium of main duct of large exocrine gland is. Answer is stratified columnar epithelium. Remember this. Like we're talking about the Stenson's duct, the Wharton's duct, duct of Wirsung, Centurioni's duct, common bile duct. So all these ducts, they're lined by stratified columnar epithelium. Remember this. MCQ number 5. Ascending pharyngeal artery sends its meningeal branches into the skull through all of the following foramina except. Now this MCQ is going to make you learn that through what foramina ascending pharyngeal artery sends its meningeal branches. So remember that this ascending pharyngeal artery sends its meningeal branches through foramen of lacerum, jugular foramen also, anterior condylar canal, the hypoglossal canal also. But remember, posterior condylar canal, it doesn't give any meningeal branch through this foramen. So answer here is D, posterior condylar canal. Question number 6. Which bone is fully formed at birth? Hyoid bone, ear ossicles, clavicle, styloid process. So I hope you must be knowing this. It's an easy thing that ear ossicles develop before birth. These ear ossicles, they actually start forming in an embryo at around the 4th week of intrauterine life and gets fully developed by the 4th month of intrauterine life, and gradually it attains the adult size before birth. So a newborn baby is born with the ear ossicles of the same size as that of adults. So you remember this point about ear ossicles. While if you're confused with clavicle, let me tell you that clavicle is the first bone to start ossify. It starts forming even before the ear ossicles. But clavicles attain the adulthood around 21 to 25 years of life. The medial end, the sternal end of clavicle, it's formed by the secondary ossification center, which fuses with the shaft at around 21 to 25 years of life. So clavicle, it's the first bone to start ossify, while ear ossicles is the first bone to completely develop, and that is before birth. MCQ number 7. All of the following tendons cross the wrist joint through the extensor retinaculum except brachioradialis, abductor pollicis longus, extensor carpi radialis longus, extensor carpi radialis brevis. I hope you know that there are 6 compartments below the extensor retinaculum, right? So from the first compartment, it is the abductor pollicis longus along with extensor pollicis brevis that comes out. From the second compartment, it is this extensor carpi radialis longus and extensor carpi radialis brevis that comes out. From the third compartment, it's only single muscle, and that is extensor pollicis longus. And to the fourth compartment, it's the extensor digitorum along with extensor indicis. To the fifth compartment, it is the extensor digiti minimi. And to the sixth compartment, it's extensor carpi ulnaris. So I hope you got the answer now. Remember that brachioradialis doesn't passes below to the extensor retinaculum. It is inserted onto the lateral aspect of the styloid process of the radius. Answer is A. MCQ number 8. Medial cutaneous nerve of forearm is a branch of ulnar nerve, median nerve, musculocutaneous nerve, medial cord of brachial plexus. Easy one, you know the brachial plexus, and this nerve is a branch of medial cord of brachial plexus. Both the medial cutaneous nerve of arm as well as the medial cutaneous nerve of forearm, they branches from the medial cord of brachial plexus. Question number 9. Wrist joint can also be called as distal radio-ulnar joint, radiocarpal joint, radio-ulnocarpal joint, intercarpal joint. So you know that the lower end of the radius articulates with the scaphoid and lunate bone. However, triquetral also participates in the formation of wrist joint, but it does not articulates with the lower end of the ulna because of the intra-articular fibrous disc, which separates the lower end of the ulna from the triquetral. So there are 4 bones participating in the wrist joint, that is lower end of the radius, scaphoid, lunate and triquetral. But radius articulates with scaphoid and lunate. So the joint can also be called as radiocarpal joint. Question number 10, the last MCQ here. Which of the following cells in male undergoes second meiotic division? spermatogonium type B, primary spermatocyte, secondary spermatocyte, or spermatid. So remember that this secondary spermatocyte is the one which undergoes the reduction division within the seminiferous tubules, and this secondary spermatocyte divides to form spermatids, and those spermatids later on transform to form the spermatogonium, and that process is called spermiogenesis. So the answer here is C, secondary spermatocyte, and it's done.